So, how's the lower back doing?
It's actually doing really good.
Oh,
Yeah, I would normally have at least 1 or 2 episodes a month, maybe more, depending on what I was doing. Sometimes just sitting wrong and then standing up and feeling like everything pinched up, and I would have the sciatica. But since I've been coming here, since we've been working on it, I haven't had an episode, honestly,
I'm
since
glad to
we've
hear
been
that. You've
working
not
on
had
it
one
here.
episode.
Correct.
Now, Michelle has also had neck issues due to the misalignment. When the lower back is out of place and your sacrum was jammed, that's why you couldn't raise. What we discovered was she didn't have full range of motion with her left leg because her sacrum was dropped down. When that drops down, that causes a distortion pattern all the way up to the top, which was giving you pretty bad headaches, right? How much better? Now, even though she had, her biggest complaint was the lower back, our biggest concern was the neck and the headaches, because because of the sacrum causing a distortion in the cervicals, now she wasn't getting good blood flow to the brain, which gives you headaches.
Right.
So how much better are the headaches doing?
Definitely a lot better, not nearly as often.
Give me a percentage. 0 was when you came in, 100% is all better.
I've got to say 75, 80%.
75, 80,
yeah.
so we still have a little ways to go.
I mean, I've had a couple headaches, but not nearly.
She's still a work in progress, right?
Right.
But here's something that she did not report to us till later on, which I really want everybody to know. The chiropractic is more than just low back pain or even headaches. She was developing carpal tunnel, numbness in the arm, hand, wrist. What's going on with that?
I've not had a problem. I haven't noticed anything. When I first mentioned it to you, it was a month or so ago.
Correct.
When I mentioned it and you were trying to feel on my arm, and I was jumped out of the chair, it hurt so bad.
Right.
And it's not doing that now. And I was having a problem in my wrist where even when I go to pick my purse up, it would be weak and I couldn't do it. I have not noticed that at all.
See, medically what they do is they cut the flexor retinaculum, a band that holds all these carpal bones together, but that's not the problem. The problem really was emanating from her spine, from the neck, causing decreased electrical flow down the arm, which was causing a weakness here that causes these bones to misalign. So we realigned the bones, the carpal bones, mainly her lunate had misaligned anteriorly, and we relaxed some of these brachioradialis muscles and the infraspinatus. And if you really look over here, Kate, her neck curve, the good Lord designed us to have an arch in our foot to absorb shock. We're also designed to have a lumbar curve, a thoracic, and a cervical curve. Look how, here's her jaw in the back of the head. Her neck curve should be going forward this way. It's actually not only straight, Michelle, but it's actually reversed, going the wrong way. And that causes so much pressure down in here, which affects the nerves that go down the arm that we're causing, probably relating to your carpal tunnel, and also causing degeneration. Now the thing is, you have an anterior longitudinal ligament that is actually shortened, like a bow and arrow, if you tighten the string, the more that arrow bows. Well, yours is actually bowing in the wrong direction. So really, for her to have long-term relief, she's going to have to do some work to lengthen the anterior longitudinal ligament, because that ligament is actually shortened. So we can adjust it, but that ligament wants to shorten again. So we'll need to give you a little more intense exercises than what we've started you on to really strengthen the posterior musculature and lengthen the muscles on the anterior side to restore the cervical curve so that you have resiliency, and it's not just boom, boom, boom. Every time you take a step, the head is just ramrodding into the neck and wearing it out at an accelerated rate. We don't need that. So hopefully, by God's grace, maybe in about a year when we re-x-ray this, we'll see a much nicer curve, and there'll actually be less degeneration. Okay?